Alright, so today we're going to be doing a hip adductor wrap. So before we get started, I'll ask my athlete if they've had experience with being taped before.
Yes.
And are you allergic to any of the materials found inside the tape?
No.
Alright, so just to help it stick to her a bit better, as well as reduce some of the friction, I'm going to take our pre-tape tough skin, spray down the area that I'm going to be putting my wrap around. And so I have her with a taping block under her right leg. And so if I can just ask you to get your hips squared up to me. All right, thank you. Putting a bit of load on her leg just so that it's going to be the size that she needs for when she's in play. So taking my double-inch tensor, or double-sized tensor, I'm going to be coming from lateral to medial. Going to dog hair my first wrap here. And with a male athlete, I would just be a bit more careful in the groin region as it's a bit more sensitive. Still maintaining that with a female athlete as well. And so if I can just ask you to raise the edges of your shirt, thank you. So I'm going to palpate out iliac crest here. I'm going to bring my tension a bit more, coming above iliac crest, releasing pressure on the back, and then bringing it down back into her inner thigh, bringing it back around over iliac crest, bringing more tension as I come across, come around the back, bring it down a little onto the thigh again, and just continuing this until I run out of my tensor wrap. And I'm just going to wrap it around as I'm running out. If I can just ask you to hold it here for me, thank you. As I go and grab my zinc oxide so I can anchor this down. Thank you. Now that I've got my first wrap anchored, I'm going to take some of our elastic tape. I would use Hypofix for this, but I'm just going to conserve a bit using the non-tear elastic tape instead for this. And I'm going to be following a similar premise, except only going around twice with this. So again, starting from the lateral side of the thigh, bringing it up and over iliac crest, with a bit more tension on it, coming back down and around the inner thigh, and one more time, up and around iliac crest, and have some wrinkles here, just going to try and get those out. And ending it on the lateral side of my athlete's thigh. Going to heat mold it down and then anchor it one more time. And then after this, I'll check PMS, doing cap refill, distal to the joint. Are you able to flex your knee? Yeah, bring it down. All right, good. And are you able to feel this?
Yes.
All right, and then to do some testing, I would have her abduct her unaffected leg first, and then also abduct her affected leg, just to check that it is supporting the area as well as inhibiting a bit of movement. and then have her continue into sport-specific tests to make sure that she's able to return to play.